Okay, come on in. Let's work through some of that stress and anxiety, some of the stuff that's coming up on the holidays. We're going to be going through this step by step, helping you relieve stress and anxiety. And today we're going to be giving you information that you can use practically about your body. Put in an intention for the day that you have. And today is, just so you know, today is a day to get stuff done. It's an action day. It's a day that you might actually have some stuff coming up from your past, some old patterns, just to say hi. How do we learn what you do in India? Yes, we have online our 28-day reset, our lifestyle artist program is where you learn it. It's all online. You can do it anywhere in the world. I got a poor connection here for some reason. Urine therapy benefits. Go over to Certified Health Nut, and he has a lot of information on it. We don't have a lot of published information on it. I have lots of anecdotal science, like from my own and patients and that over the years, but he actually has factual information and studies on it. And there's a lot of books on it too. How did test go? What test, Stacy? Good morning, Maria. Can I talk about vaping? Vaping is not good at all. It's worse than cigarettes in every way, shape, or form. They just got everybody hooked on something else. There's lots of chemicals, including glyphosate and pesticides in the vape fluid. If I was going to vape, I would vape pure tobacco only, and it'd be organic. But vaping is not good. Now, what you can do if you want is you can put essential oils in a vaporizer. And you can vape essential oils, like you can do black pepper. You can do another one I like is a little bit of frankincense. But if you vape those, you're actually healing your body. Hi, Neelam. Good to see you on the weekend. Ovarian cysts. Ovarian cysts, lower reset hydration, so diatomaceous with Irish sea moss. Boron, you can get it through borax or boric acid, but I would be doing it through the lower reset because you got to move the tissue. You got to move that tissue. Here, let's make this a female. I'll show you what I mean. Okay, here's a female. Here it. Let's go for. I'm gonna remove the. Okay, I'm gonna remove the nervous system here and get into. Oops. Okay. Sorry. So this here is the ligament or bladder that goes over the uterus and the ovaries sit up in here, and I'll show you what that looks like in a second. Now, okay, these are your ovaries. Now, I want you to notice something. Here, let me take some bones out here so you can get a better view of this. Take this out. Take out these bones here. Okay. Now let's take out a femur too. What the heck? Okay, that's the side view. Okay, now I want you to notice that the colon and the uterus to the vagina is also very much the same shape. And the reason why is this angle is because of sitting and how the body flows. This is why squatting is so important, because when you don't squat, this angle gets tilted. It gets tilted forward, which is an anterior tilt. It's when it gets tilted forward this way. And if it gets tilted forward that way, you're going to have issues with the uterus and also issues with the colon. But here we go. Let's go back to the question about cysts. So there's a lot of places that you can get cysts. One of the common places is right out here. Another one is right in here. Another one is right here. And if you take a look at it, okay, now we're going to put the bladder, or sorry, I'm going to put this back on. Whoops. Right here. So you see how the ovaries come out through here, and they come out right through the ligament right there. So it's quite often you get a cyst in here. Now, what is all that stuff connected to? Let's pull that back and show you. I'm going to show you here. Oops. So if we take this away, these are 4 layers of the abdominal walls, each of them covered by fascia. Now, so look at how snug it is in there. Okay, now all these things here, the fascia between this, it looks like it's separate there, but it's not. It's actually fascia in between it. And the fascia in between here is sticking there, it's sticking here, it's sticking to the abdominal walls. So when you do like a psoas release in our lower reset, what you're doing is you're pulling all of the fascial tissue in a zone up like this. And when you pull that fascial tissue up like that, it actually pulls the ovaries off of the tissue and then creates flow. Because what is a cyst? It's a blockage of flow. There's layers of fascia that make up every organ, every muscle. And when part of it gets pinched or blocked, you're gonna get fluid buildup in there, and that's what a cyst is. So what you want to do is you want to do that, and again, you remember from the psoas release, you're putting your hands right on this area, and you're pulling up this way. Now that is going to pull the ovary off of the pelvic floor, and it stretches the tissue on there. And there's multiple layers of tissue between there and the actual stomach. Super powerful, and this is where you're going to get rid of the cysts. But cysts always come, in my opinion, and what I've noticed, they come with dehydration. So diatomaceous earth and Irish sea moss, so you can get the water into those tissues. Was that of assistance?
It's early for dad jokes.
Early for dad jokes. Dad starting radiation for prostate cancer. Tumor size of a raisin. Well, Mello, 12:30. You can't talk them out of it. You can't talk them out of it. There are people, the majority of people that die, like a high percentage, like we're over 50% of people have some sort of, when they die of old age, have some sort of prostate cancer. People don't die of prostate cancer. They certainly die of treatment, though. Headaches, face, neck, and sprain. So, Nikki, 2 things. You're going to need hydration. It sounds like if you have a headache with face, neck, and a sprain, that you had an accident. That means there's a whiplash or something like that. If you've got that going on, you're going to need to do the upper reset. The upper reset starts with the whole body. And it's important to do the whole body first. If you don't do the whole body first, this is just one zone. If you got pressure in here, you got pressure here. If you got pressure in your glutes, you got pressure here and pressure here. So you have to do the whole body, but the upper reset will usually get rid of that. If it doesn't get rid of it for 2 days or twice a day for 3 days, I can almost guarantee it's chronic dehydration. You're going to need minerals. Fast breathing even when sleeping. The central nervous system stress, you're probably tired a lot. Usually dehydration, compression of the fascial tissue, especially around the lungs. Overworking of the organs. What it's saying is you need to get hydrated, reduce your inflammation, clean out your GI tract. It's a 28-day reset. And it looks like angels. Hi, Maura from Sacramento. Fibroids. So fibroids is the lower reset. Do the lower reset on a daily basis. And again, if you have fibroids, cysts, fibroids, cancerous cysts, it's all the same thing. You have to move the tissue. You have to get it hydrated. The cure for frequent vaginal infections. Okay, so when people have frequent vaginal infections, recommendation is the minerals, diatomaceous earth, Irish sea moss, and boron. I would be bathing in borax. I would be bathing in diatomaceous earth. I'd be bathing in Epsom salts, a 1/4 cup of each, 1 time per day. In addition to that, doing the lower reset. An infection is because you have fluid that's not moving. It's like even when you have like an infection in your hand or your skin, you run water over it. You're creating flow. The flow is what's going to cure it. And usually infections, vaginal infections, are going to be stagnation and fluid and movement. And so the lower reset and the barefoot sprinter routine #2 are really good for that. You have to take the supplements though. You're going to need to get the hydration in there if you want to get rid of it quick. I would take the Power Cook 30 at 6 tablets per day, along with the diatomaceous earth and Arishimos. That's going to kill the parasites, and it's going to readjust the back. Poor connection again. How's that
really?
possible?
This is what it says.
Yeah. Do I need to reset the internet?
Let's see.
No. Okay. So I would get the probiotics. It's important because the probiotics and I would take 6 to 10 a day, 6 to 10 of the P3OM per day for a vaginal infection. Drinking water, increase hydration. Actually, most people drink demineralized water. So the answer is no, it's actually the opposite effect. It's taking minerals will help you hydrate, taking H3O2, which is from a structuring device, like a machine like our Alcaviva machine, which you can get off of our partner section. You can go to H2 Water Experts and Alcaviva. That's one area that you can get hydration up. Drinking coconut water or juice, non-pasteurized, of course. But drinking more water usually is the cause of dehydration. Irish sea moss and diatomaceous earth. My little cousin's doing treatment for brain tumor. Yes, if oh hi, it's Evolved Me. Yes, there's a parents group you can get into. We have Leah Brown in there, has a brain tumor after I think the 3rd operation was coming back. What she's done is they've done fascial maneuver since July. Last check, I believe it's 75% reduced, and it's on the brainstem too. So ask to go into the parents group. That will be on the platform soon. Kids can take the supplements for sure. I'm in menopause. I had extreme weight gain, weight double of what I used to. That's not menopause. That's hormones and hormone disruption and lack of ability to absorb and dehydration. So menopause shouldn't cause weight gain. Disruption of hormones, which are caused by dehydration, because your body's going through a hormonal change, which is going to be caused by dehydration, because when you're dehydrated, you don't absorb the water properly. And the water is required to absorb all the, and the minerals are required to fire the hormones. If you have any of that dysregulated, you're going to have weight gain. Yeah, I mean, look at if you had to put salt in, rice size of salt. No, I mean, listen, if you're having hydration issues, get to the mineralization. Putting salt in your water is good, but it's not going to, if you're deficient in silica, which almost everybody is because of the chemicals in the air and the clothes and the food, you're not going to absorb it. It doesn't matter what salt you put in. I get people all the time, they're like, I take my Himalayan sea salt every day, I take my lemon, I do that every day, but they're dehydrated. Why? Because they're missing silica. What's up with the world's energy right now? Hey, Magna. World's energy, anxiety, headaches, tightness. So first of all, the world is going through an energetic shift. In personal health, in the next 6.5 weeks is going to be the most dramatic in human history. People everywhere are sick or having some sort of issue if you haven't noticed. We're going through a change. We're going through a destruction of control and power systems. And right now it's personal, it's inside the body. Starting in 6 weeks, it's going to be in your community, at your work, and then for 3 months. And then after that, it's going to be in the world. If you really want to know what's going on in the world, go back onto our website or go onto the YouTube, go onto YouTube or our website and look at the Astro Mondays. And look at them for the last 8 weeks, and you'll see exactly what's happening in the world. We go through that in pretty much heavy detail. Oh, if you tried UT for the first time with the flu and threw up, that means that there's something that your body was trying to process. If you threw it up an hour later, it's not the UT that you're throwing up. It's something bacterial or viral or parasitic. And that's pretty normal. That means that your body was trying to get rid of something. That's for scrambled darts. Try it again, and I would recommend looping. So I'd recommend doing it 2 or 3 times a day. Again, it's not the urine that's making you throw up. Otherwise, it would have come up right when you touched it, but that's not usually the case. Sorry. Hysterectomy caused by menopause. Yeah, okay, so we have a lot of women coming out of menopause in their late 50s and 60s right now because we take the body out of stress and we hydrate it. So it's the same thing. If I had a hysterectomy, I would do the 28-day reset. I would do it 2 months in a row minimum with all the supplements and just let your body rebalance because your body's trying to rebalance. That's what's happening. Hydration in the body. Okay, we have a 28-day reset. Follow the supplement guide there. Your body will hydrate right away. I'm bleeding 3 days due to periods. What should I do? What I would do is, if you haven't done it yet, make sure you're taking the minerals. And then we do the lower reset. I do that a couple times a day with the psoas release a couple extra times a day. Do that right now, get the flow going. I don't think that's an issue. I mean, it should, if it goes past 5 or 6 days, then you want to do something. But if you're doing the maneuvers and you're taking care of yourself, you can have bleeding and spotting. It's not abnormal. I have a bladder sling from stress incontinence and it's failing. Anything I can do to help with maneuvers? Yeah, the lower reset and the barefoot sprinter routine number 2. And you're going to need, if you're having incontinence, you can do the lower reset. Do that twice a day with the barefoot sprinter routine number 2. But you've got to get hydration. You've got to get diatomaceous earth and Irish sea moss. Because it causes contraction, and that contraction goes around every organ, every vein, every nerve when the body's dehydrated, because everything lives in fascia. If it contracts around the bladder, then you're going to have incontinence, especially like when you move or jump. Forgot to tell you, when I schedule live with you, I woke up to all my followers, white people here trying to censor us. Unknown pain, abdomen, hernia, ulcer, diatomaceous earth seems to agitate it. Answer, I've been trying to soaking my feet in urine. Okay, well, first of all, I would be drinking your urine with the unknown pain, abdomen. I wouldn't be, I mean, you can put it in your feet and all that, but I would be drinking it. The DE, if it's agitating it, usually it's something in your small intestine. The DE starts cleaning parasites out of the small intestine, so sometimes it creates an agitation. Reduce the DE for a minute, increase the Irish sea moss, take the Power Kirk 30, increase that up to 6 to 8 per day, and do the lower reset. Get the psoas release, the belly button, untorque, and get that in there. High blood pressure, hydrate your body, get it moving. The upper and the lower reset, barefoot sprinter routine number 2. So do lower reset, barefoot sprinter routine number 2, and then next day upper reset, barefoot sprinter routine. Get your hydration up, your minerals. That's usually what gets rid of high blood pressure. Best thing to clean mold on surfaces, including ceiling. You can use essential oils. You can use vinegar. But if you have an H2, if you have an Alkaviva water filter, use the acid level 2. It gets rid of it right away. Yeah, so I've been sick with this cold flu going around for 2 weeks. Have you noticed that almost everybody's sick or got something going on everywhere? Yeah, it's right now I would be heavily taking moss, diatomaceous earth, Power Kirk if you had it, boron. I'd be bathing and I'd be doing maneuvers. You guys, even in our own crew, we've got little issues happening, but ours are not that bad. I've had stuff going on. Dizziness for months after chiropractic, cracked my neck. And this is handle chops. Do the upper reset, and there's also, if you want it, there's a head and neck masterclass that Jason does. You can DM us and we'll send it to you. Bleeding because of periods for 13 days. Okay, so I know you're in India. I don't know what I don't know what natural healthcare is like over there, but I would keep moving tissue and keep mineralizing and just trust your body. I know you've been doing maneuvers for a while, so just trust your body. Make sure that you're getting all the minerals in there and keep moving it. Okay, how can you bask and bath clearly without chemicals? Okay, this is a good one. So one of the things that you can use is there are treatments for fluoride, fluorine, vitamin C balm, bath bomb treatments that you can get that clear chemicals out of your bath. That's one way. Diatomaceous earth, Epsom salts, and borax with bath bomb, and that should do you pretty good. Does anybody experience emotional releases during fascial release, or do some people only experience physical? This is for living Amy Lauren. Everybody going to have an emotional release. Now, whether they process it or not, because some people they're not even aware of their emotions, but as they do them more and more, and as they hydrate, eventually, if they're not responding emotionally, eventually they're going to have one of those moments that's anger, frustration, sadness, joy, something like that. People, even the most staunch of ones get it eventually, right? Friends, early stages COPD, hydration, upper reset, yes. Partnered maneuvers, and hydration protocol. But the COPD, high doses of Powerkirk, 8 tablets per day for about a month will really, really kick that.
What the heck?
I don't know why it's freezing. It says poor connection. Hold on 1 second. I'm going to turn off. How to eliminate parasites. Our 28-day reset is meant for that. Gary Brecka, yes. Here's my thoughts on methylation. Okay, Gary's a smart guy. I don't think Gary has run lab tests on people like us who do fascial maneuvers and have open fascia. The reason why we don't methylate is because of dehydration and contraction of fascial tissue. For example, when I go 2 weeks without drinking water, which you're not supposed to according to Gary Brecka, you would die. What I do is I sit in a bathtub and I absorb the water. Well, if I'm absorbing water that way, I'm also methylating. Your body will process when your fascia is open and your body's hydrated and properly mineralized, you will process and you will methylate properly. Now, if you don't have the methylation gene, same thing. I mean, just because you don't have the methylation gene doesn't mean you can't methylate. It means that your body under stress is not going to do that. Why is that gene activated? It's stressors in your body. That's just not thought about in normal medicine or science today. Hold on a second here. Moving my fascia around this weekend. I had a treatment with Dr. Allah. And everything's just moving and it's like all over the place. Yeah, let's do it. Throat chakra. Okay, so right hand above, breathe in. 2, 3, 2 for the nose. 2, 3. I'm speaking my truth from my heart. I love speaking my truth. I perceive that speaking my truth is in my highest benefit. Wow. Lisa, actually, it's clearing something. You're darn right. Not like I didn't do that earlier either. Maybe I didn't. Oh, now I got like cramping in my calf. That is so weird. Hold on a second here. Let's do this. Let's do a whole organ reset. Okay, I'm gonna do my cat first.
This is an organ reset, Gary?
My cat first. My body.
Or part of the organ reset?
No.
Okay.
Just my cat barefoot sprinter routine. There's lots of changes since yesterday, since we went hiking. Okay. So let's do an organ reset. Let's get our hands ready. This is the fastest way to reset your organs. It's also to rebalance your body, nervous system. I'm rubbing my hands together. I'm gonna rub my fingers together. Knuckles. Yay! Looks like I did something. Still don't know how to make this work. Okay, hands on your belly button. Your right hand, go 2 inches to your right and 2 inches down. Now you can just put it here, or you can pull it up and twist it. So I'm going to twist mine, okay, get a little bit more action on the ileocecal valve. Okay, put your left hand up here on your neck. You can put it over here. That's too hard. And breathe in 3 times to the mouth and 3 times to the nose. 2, 3, through the nose. 2, 3. Okay, let's go up to the liver gallbladder right underneath the rib cage there, pushing in, turning. Again, you can just put your hand there if you can't push and turn. Okay, breathe in through your mouth. 2, 3, through the nose. 2, 3. Okay, let's go all the way over to the other side. This is to the stomach. So here's my center bone. I'm going down to the left, pulling in the stomach, pulling it across. Breathe in. 2, 3, through the nose. 2, 3. Let's go down to the left hip. Pulling up here. Breathe in. 2, 3, through the nose. 2, 3. Go for the bladder. Breathe in. 2, 3, through the nose. 2, 3. Okay, rest for a second there. Let's go in the right rib cage, pulling down, squeezing, left hand over, lean over, turn your head to the right, breathe in 3 times sharp. Now it's activated. Let's take 6 breaths. Breathe in through your mouth. 2, 3, through the nose. 2, 3. Okay, let's do the left side on the rib cage there, pulling down, hand over, breathe in. Oh, sorry, 3 times sharp. Okay, now breathe in. 2, 3, through the nose. 2, 3. Okay, left hand on the thumb, breathe in. Sorry, left hand, thumb on the spine, on the spleen. Hand right across the rib cage. Chin to chest, leaning on the right foot. Breathe in. Through the nose. Okay, getting very calm. Let's do the throat and thyroid again. Pulling skin up, left hand behind. 2, 3, through the nose. 2, 3. I'm going to do a Let's reset. I'm going to pull up and twist, counter twist and squat. Like I said, I got lots of fascia moving around here. Hand on heart, hand on head, right hand on heart, left hand on head. Breathe in. 2, 3, through the nose. 2, 3. Okay, I'm gonna do my ears a little bit. So both thumbs in the ears, grab the ears, torque it. Breathe in. Look up. Through your nose. Then I'm gonna start to torque and twist. Okay, I'm gonna do vagus nerve, left hand right here on the trap area, pushing in and pushing down. Right hand on the jaw. I'm gonna push it over, away, squat and turn to the right and look up. Right hand on the trap, again, pushing in, pushing down and away. Left hand on the neck, pushing the head away. Squat, turn to the left, look up. Okay, feels like I need to do my elbows too. So right elbow up here, turn the skin. Come over to the top, lean to the right, or left, sorry, away from the elbow. Turn your head to the right, breathe in. Step behind with the right foot, get more. Wow, I had lots of contraction in my tissue, but I did a whole organ opening up with my friend Dr. Alla on Saturday night after the event. Breathe in. Stepping behind with my left foot. Whoa, how you guys feeling? Did that get you guys going?
So Gary, you said that with Dr. Alla, what were the emotions coming up that made you want to do that organ reset in those this morning?
It's not emotions, I was just having physical issues. My mucus in my throat that's coming from here, this is all opening up. My neck was opening up while we were hiking. And when I get dislodged or anywhere in there, I get mucus in my throat, but everything's shifting. You've seen my face shift. That means my shoulders have been shifting. I've been letting it do it naturally. I haven't been doing therapy to make it happen. Okay. Let's see what's going on here. Working on flooring. Okay, for reset, is there an emotional component to cellulite? Yeah, actually, there is an emotional component to it. Cellulite, let's see, can I do this? It's not, it doesn't let me show any of my pictures anymore. Can you look and see if you can, like, bring it on Instagram? Can you, I've been trying to figure it out. I used to bring up pictures and photos and videos. So, there are, oh, hold on a second here. Maybe I have it here. Hey, maybe I have it here. Let's check it out. Okay. Oh, here we go.
Oh, good.
But I still would like to do it.
Okay, I'll figure it out.
Okay. What does that look like? Looks like a pelvis to me, right? So when you look at a bone, when you look at a pelvis, you're supposed to see the bones here, right? Oops. Let's see the bones here only. What do you think all that white stuff is? This is an x-ray. What do you think the white stuff is? This is very common today, by the way. And look at this. See how it's here? It's in layers. What are the layers? Anybody in medicine, anybody in science want to explain what this white stuff is and what the layers are? I mean, I know what it is. This is calcification of layers of fascia. Now, if fascia is like a sheet, right? Fascia is like a sheet, and you pull it and you pinch it right here. Guess what it's doing? See, it's pulling all of the tissue right here. What's that going to look like? That's going to look like a divot or a dimple because it's on the inside. Guess what cellulite looks like? You see? Yes, a lot of it has to do with grief. That's a big component, but there's other emotions. I mean, there's an emotional component to holding of anything. Basically, weight and fat is not what I thought it was. It's water being held in the body to release an emotion over periods of time. That water will stay there. Because like I was working with like literally fitness models and CrossFit athletes, women. And they're like have complete six-pack abs, lean everywhere, and they get cellulite on their butt cheeks and on their legs. I'm like, how is that possible when they're that low in fat? Well, how would they could have cellulite? And there's nothing they do to get rid of it. Now, when we give them minerals, diatomaceous earth, Irish sea moss, and we give them power kirk, and then we do rotational movements of fascial maneuvers, guess what happens to all the cellulite? It goes away. Parasites, 28-day reset. It's the diatomaceous earth, Irish sea moss, and Tarka FND. Can you give me the actual diagnosis or whatever it is? I mean, you got to think about it. There's roughly another 40 to 60 diagnoses that's happening every day. They use initials for everything, so I don't even try to memorize it anymore. What is something you need to hear as a 15-year-old? I'm struggling with how I best support my son. 15-year-old, get the chemicals out of their diet, do the partner maneuvers on them, get their GI tract going back again, literally take the 28-day reset protocol, give it to them. What happens is they feel disconnected from their environment, their world, and they start acting out. And that's usually because of lack of ability to uptake serotonin, they're not getting dopamine, and they just start acting out. And generally when teenagers do the 28-day reset, generally within the scope of the reset, they change their behavior dramatically. Jolly Gal, Capricorn having relationships, and yes, everybody's doing that because we changed as people. Go back and listen to the last 4 or 5 Astro Mondays. It's on our website, it's on our YouTube, it's on the Instagram, and with Chris Witecki and from Serious Joy, and you'll see we're all changing. People are changing careers, relationships, they're changing their relationships with themselves. So you're changing as a person, and a lot of people aren't going to react to that. They're doing their own changes. Some of them not so good. Yes, for sugar substitute versus sugar, we have Fascial Sweet. You can go check it out. Fascial Sweet is made with 2 glycosides, one from one of the constituents of stevia, one from monk fruit. Tastes like sugar. It regulates blood sugar within 10 to 15 minutes. Has 0 calories. Super powerful. We use it in everything. I used to eat even like dark chocolate that had sugar. Now that I've been away from it, I can't even eat it. I can't put anything with sugar in my mouth at all, even if it's organic. Neck and cervical pain on the left side. Go to the upper reset. Do that upper reset with the barefoot sprinter routine number 2. Do that twice a day, but make sure you get your body hydrated. Minerals. Can we put regular vitamin C in a bath? I think the answer is yes. I think you could use ascorbic acid. I just don't know. I honestly, I don't know. I think the answer is yes. because vitamin C shower heads take out, you know, fluorides, fluorine, stuff like that. So I think you could probably take vitamin C or ascorbic acid and just throw it in. What kind of reaction are you having to sea moss? It's probably not the sea moss, it's probably your body starting to clean itself and detox. This is for your son with autism, Bell, Randy. There's a parents group that will show you how to, everything you need to know. We have children coming off the spectrum every day. The parents group, you can DM us for that, and we will help out with the parents group. So just say, I want to get in the parents group. It'll be live on the platform, on the new platform. If you guys haven't checked it out, try the new 28-day reset. Go to our website and sign up with Circle. Wow, lots of parasite cleansing today. Guys, just do the 28-day reset. It's designed for parasite cleansing. Voice and vocal cords. Vocalist, do the upper reset and the head and neck masterclass with Jason. Upper resets on our website, head, neck masterclass. Just DM us, we'll give it to you.
Good morning. Good morning.
Elevated blood sugar and candida. I can eat 15 grams of carbs. Okay, Tammy Roach official. Tammy, you've got to get the minerals going. Diatomaceous earth, Irish sea moss, boron. That'll help right away. You've also got to get the stress down in your body, so move the tissue. Go in the 28-day reset. Just do a complete reset, because you're going to be playing around with this for years, trying to figure this out. But the elevated blood sugar is usually because of a lack of absorption, a hormone dysregulation, quite often because of lack of ability to absorb food, and dehydration. Hey, Kelly Green, I'm glad that you had a good time at the event. Yeah, Saturday was really cool. Best thing for gut health is the 28-day reset. You guys, I see people all the time play around with this. They're like, oh, I'll just do this one thing, or I'll do one thing over here. And then you just trade one problem for another, and they do it for years. Do the 28-day reset, get it done. Is silica safe? Yes, absolutely. You can actually DM us. We'll give you 31 evidence-based facts on why diatomaceous earth works. Scientifically proven. Crystalline or non-crystalline silica. Diatomaceous earth is what we recommend. We've tried everything else. It works the best. Next to that is horsetail. Yes, any maneuvers for sphincter. Do the entire lower reset, and you can DM us. We can give you an anal sphincter release. You can do it yourself. A partner will do it really good. You don't need a doctor to use a balloon to do it. I mean, it works, but that's not the most effective way. Literally taking a squash ball or a racket ball, putting it in while you're laying down, have somebody put it into the tissue, turn it counterclockwise, turn it, really turn it and hold it. But you can actually DM us for the anal sphincter release. It's on our YouTube and it's on our Instagram. My voice keeps going out from a regular, like a Star Trek episode. Yeah, well, we are in Mercury retrograde, man. We had, just to let you know, we had our menu for our mobile app go down yesterday. We had the app that we use to answer questions to people delete a user, and that wasn't it. I mean, we had other stuff that's happened. Download our supplement guide. You'll get our minerals. Yeah, Astro Mondays, you can catch them on our website. You can also catch them on our YouTube. Parasite cleanse again. Wow, everybody's asking about this. Plus, after attending your autoimmune class last evening, it just became so clear why my body hasn't. Good. Do you want to go live? Let's see if you want to go live. I just try to bring you live. Let's see here. Do we get this as a female? Yes. Hello, Agna. Are you able to get on?
Yeah.
Looks like we get a bad signal. Okay, bad signal. Okay, we'll have to try that another time. Okay, so let's talk about autoimmune. Okay, let's talk about autoimmune. This is a female. Before I get busted for saying you got a male on there, because what I often do is I take these off, go like this. People go, like, "That's not a female body." Oh, look at that! Oh, they did this new now. Wow, that's cool. Okay,
I have a question.
that's new. Yes,
Don't males get autoimmune?
yes, but I'm doing it on a female body.
Gotcha. That was a legit question.
Okay. Now, this is your kidneys. By the way, most people don't know that. Your kidneys sit right underneath your diaphragm, right? And the urethra goes down in here. That's why a lot of times you get like what feels like a UTI, but it's not a UTI because there's compression in there. And notice the diaphragm has two big holes up here. One hole's for the arteries and one hole's for the esophagus. Esophagus here and the artery here. So from the stomach comes up, the stomach sits right about there. And when you squat, that hole gets pressurized and it moves pressure, air pressure from down there to above here. Let's take some of these muscles off. Okay, so now this is the funny thing about apps. You see how these both look the same? These adrenals? They both look the same, right? Like that, this looks like that. That's not the way it is in life. This one is round like a moon. This one is there. This is why anatomy apps and all the stuff that we're going, if you haven't worked on a body, dissected a body, put your hands in a body on a regular basis, I mean like over and over again, you can't go buy an app and you can't go buy an anatomy book because it just isn't that way all the time. Organs can move around too, by the way. Okay, so then let's put the digestive system on here. Okay, here we go. You got your liver there. And let me take the diaphragm out here. Oops. So you can see it better. I'm going to take all these out. Take all these out. Take all these out. So just so you can see it better. Okay. So this is your liver right here. And this is your gallbladder sitting right there. This is why when we do the gallbladder release, it's right up there on the right side. Now, if your liver is necrotic, and this is one of the things that I kept saying, so if this liver here is necrotic, means what they'll do is they'll cut half of it, they'll exnate it, and it'll grow back. If you can grow a liver back, then why don't you grow a gallbladder back? Why don't you grow a kidney back? You see what I'm saying? Like the liver arguably is more complex than the kidney. The liver is your pharmacy. It's 400 known functions, 400,000 variations. It produces it monitors your blood. It keeps you alive. It's the one thing. You can go without a kidney. You can lose a kidney, but you can't lose a liver. So it's more important than the kidney. So if it grows back, why doesn't other ones grow back? And I have witnessed them growing back. Things like gallbladders here. So in this particular case here, your liver is methylating, but here's your stomach. I'm going to show you the pathway here. So I'm going to get rid of this. Liver gone. Okay. Now, there's your stomach. See your gallbladder there? See how it goes right into the stomach? Right in there. Now, the stomach, you see how we were saying earlier, how it goes up through that pipe? Right in the diaphragm, it goes right up into the esophagus. So your stomach, you'll see the tissue changes here. The stomach rotates and churns, and it's exactly like what you would see if you were looking at a dump truck. A dump truck turns, and that stuff inside turns, all that cement turns. That's what your stomach does. So this is why sometimes you'll feel like a choking sensation when you're doing a lot of organ work. This thing here can rotate, and it goes right up into, let's see here. I can't isolate the whole thing, but it goes right up into the neck, head, and throat. Let me take these out, take this out, take this out, take this out. Get rid of all these muscles. That's the gums. And there's your thyroid, by the way. A lot of issues with the thyroid. You notice it looks like a napkin. Well, also kind of looks like other things. So let's take that out. Okay, there you go. There's the esophagus coming up to there. And then what comes down through there is the tongue, actually, right down into the body. It goes all the way down. Your tongue, actually, fascial connections right to your toes, but it goes right into the heart, right into the stomach. So in the esophagus here, like if your stomach is rotating, you'll get it rotating up here. And sometimes you feel it like something gets caught or stuck in your throat. Okay, so we're going back down into the whole pathway here. So food comes down into here. Now it starts to churn, and there's different levels. There's a flap there that releases the acid. There's the upper part of the stomach and lower part. Let's see if we can see that here. There you go. You see how you have a lower part and you have an upper part here. Now let's take some of these. Whoops. And in here, so it comes down in here. The flap opens up. You get all your acids in there. Now, this is why drinking alkaline water is not going to change your body pH. Your stomach is a pH of 1. Acid. If you even put a drop of lime in 11.5 alkaline water, what happens to the water? It immediately loses its acidity. So the acidity, if you take, a drop of alkaline water and put a drop of lime there, the acid, changes the acidity. It takes away the alkalinity right away, the acidity right away, and the alkalinity, it balances. So you're drinking alkaline water, it's not going to make it through your stomach, first of all. Okay, so in there, now we have this, what we call greater omentum. Now, when you look at the greater omentum, by the way, and you look at it here, it looks like a nice organ, right? When you look at it on the body, it doesn't look like that. When you do a dissection, it looks like a scab that covers the organs. It's an integration. It's a way that the organs can get information like the small intestine into the blood. It's full of blood veins here. That's why one of the things when I stopped eating for 44 days, that's where it changed my belief system here. Okay, now from the stomach, you see it tracks down here into the intestines. And here, let me move or can I do that? I'll move the large intestines for a minute there. Yeah, see right in there. So it comes out of the stomach, goes right down into the small intestines here. In this area here, it's just sitting as the food goes through and it's ready. And then it goes into this part, pre-intestine, sits there, and comes into the small intestines. Now, in these small intestines, this goes through this entire pathway. And see how this is broken up into sections. This controls, each one of these areas controls a part of your skin. So if we isolate that, that's what it looks like. And let's even get rid of the hip here. Okay, I can't do it. I have to do it this way. So food starts to go through there. Now, if there is blockage anywhere in there, and I mean anywhere in there, you're going to start to have malabsorption. So because remember that greater omentum was all over here like this. And so and each of these areas, the blood vessels from here go to a certain section of the body. And that's why you'll get like psoriasis or rosacea on areas of your body, because it's all connected in here through the blood vessels. That's it. It's not magic. It's literally, there's blood vessels that are here that are different. Now I'm going to go back to that greater omentum here for a second. I don't know if I can. No, I'm not going to go back there. So the greater omentum, so it has this big circle thing around here that sits in the belly, and each part of that pulls blood, pulls nutrients into the blood through that adaptation, and then goes to a part of the body. Now remember, every blood vein in your body eventually comes to the belly button. Go figure. That's where you got all your nutrients from when you're in the womb. Okay, so if we get rid of this,
Gary, is that is that why some people don't absorb some of like the vitamins and things from their food?
Well, they don't absorb because this issue in here, this greater momentum here is meant to absorb. If this walls in here are plugged up from chemicals, which get goop and mucus and stuff like that, if you're taking glyphosate and you're taking pesticides and herbicides, so glyphosate's going to make it gunky. Pesticides or herbicides are going to make this permeable. So it means that food literally is leaching into the blood, like small amounts of food. Now that is what you're doing. Okay, that's what's causing your autoimmune symptoms. So again, let's go back to this. Let's take this out. Oops, I'm gonna take that back and hide. Okay. So here you go. And now over here, this is where you're gonna find the ileocincal valve right here. And this is where the large intestine starts. The large intestine goes up and over underneath the liver. And that's why when you have a lot of food in you, it puts pressure on the liver itself and on the stomach and your large intestine. In other words, you're full of shit. Comes all the way down in here. But this area here, see this area? Look at it. If it even gets remotely distorted, that area there, that's the area between the small and large intestine. That's what you get with the psoas release. You open that up because this is all thin tissue. It's like a sausage casing. If it crushes like this, then it can open up, and then bacteria from the small intestine gets into the large intestine, and it continues to eat. The small intestine has digestive bacteria, so it's breaking stuff down. So that's why you get diarrhea and stuff like that. Okay. So let's put that back on. So this area here, when you are doing your psoas release, we're pulling up there and we're pulling up there. What that's doing is it's separating the small intestine and the large intestine so that flow can happen again. It's that blockage of flow that's causing you gas, bloating, and distension. And if you get pressure on here, if you get pressure down here, you're going to feel that pressure up here. And you're going to have what we call depression. So let me take the head here. I'm going to take some muscles off. Okay, let's go for our nervous system. Okay, so let's take this here. Now let's put on your digestive system again and do this here. Okay. I have this theory. Actually, it's not a theory anymore. I mean, I've proved this out so many times. Things that look alike act alike, right? What does that look like? Does that look like that? Do they look the same? Yeah, because when a baby is being born, developing in the womb, there's these two nerve clusters. So what happens is, here, hold on. You get this ball of plasma like this. You got a little nerve cluster that forms here, a little one that forms here, and then there's a line between them. And that's what it looks like for about 6 weeks when you look at it. But guess what's growing here? This is your muscle skeletal system. But what grows first is, this is your brain. This is your small intestine. So they're connected. That connection doesn't go away. They're directly connected. So if you have a problem here, you automatically have a problem here. That's why feel-good hormones, the brain releases, boof, like serotonin. Well, where does it release? In your small intestine, right? Okay, so let's get back to this. So if these guys are connected here, if this and this are still connected, and I put pressure here, like that, guess where I'm going to feel it? I'm going to feel it up here. That's called depression. Again, super simple. That's why when we want to help people with depression, we clear out the GI tract. And in there, when you take the pressure off of there, you get serotonin, dopamine, oxytocin again. Does that make sense? Okay. So, autoimmune. if you get blockages here, I'll take this off. So if you get blockages here and blockages here, you're going to have a processing issue. That means that food that comes down through here is going to spend too long in this system. When you have food in that system too long, you're going to get overgrowth and you're going to get bacteria. You're going to get SIBO. You're going to get all kinds of dysregulation because the food is literally rotting in there. It needs to flow through. Okay? Now, here's the crazy part about this. If you were to think about somebody when they sit, they go like this. So guess what happens here? That all gets pinched. But when you squat, it opens this cavity up here. When you squat, it opens this up. So it pushes the organs up and they don't get pinched. It literally puts the organs up. It's like the hands scoop under here and push the organs up so that the rectum comes down and the vagina comes down and the uterus. That means that you're actually putting those prolapses back in place. So if you get a prolapse, start squatting, literally every day. And it's really common to have disruption in through here and disruption in through here. Now let's put some muscles back on her. Okay, here's your muscles, but muscles don't show you a lot. Let me show you some of the things. Like you got your stomach, remember right about here? Well, coming down here and coming down here, that's your stomach meridian. So when you sit here and this gets really tight in here, you're compressing your stomach meridian, which is power for the stomach and also a detox. What also comes through here is your spleen, right through there. So if you're sitting here, it's affecting your immunity. This is why the psoas release and the lower reset work really good. If you're coming through here and through here, when this gets crushed, it starts to rotate inward and rotates towards the center. And what that does is right down here is your liver. So everybody who's angry has got a lot of inner thigh issues, right? So people are like, I got inner thigh issues. Does that mean I'm angry? Does that make sense? Okay, let's answer some questions now. How would one remove trauma from the body? The 28-day reset is our best tool. Just follow that. Elderly who have gut issues, use the partnered maneuver series, do the partnered belly button untorque, and do the partnered ileocecal valve release. And the partner release series, you can go to our website and there's beginner, intermediate, and advanced. You can do that for people who can't move. Same thing with children. So when we have children that are non-motion, non-verbal, stuff like that, the parents actually do the maneuvers on them all laying down. Let's see what Gabriel says. Joint pain in hands and feet, hydration through minerals, fascial maneuvers, probably need the 28-day reset. That's an early warning sign that there's dehydration and compression. Usually leads to some sort of arthritic thing. Start taking care of it now. Biooptimizers, you go to our supplement guide, download it, it will tell you. You can use other ones in there. Biooptimizers, you can use any of their gut protocols, it works. We have the basic ones for our 28-day reset. Tailbone pain, lower reset. Also with tailbone pain, when you do the psoas release, put your hands, the same thing as the psoas release, over the bladder and do it again over the bladder. That usually gets rid of your tailbone pain. Nancy White, Christopher. Hello, Nancy White, Christopher.
Well, this is a surprise. Yeah.
Well, it's only half a surprise because you requested, so.
No, I know I've requested a lot though. Hold on, I'm gonna mute something. I'm actually at work, so I can't always get through.
What do you do for work?
Huh?
What do you do for work?
Well, right now I'm working in an office, in a municipal office, not my calling. I
Yeah.
also, for the last 15 years, have been a reflexologist, health coach. I instruct yoga. Yeah.
Cool. And
So
when's your birthday?
April 18th, 1960.
Oh, master level Aries. You're all about rules and process. So you're a brainiac.
Yeah. I don't know if I'm a brainiac, but I'm in the head a lot.
Yeah.
Yeah.
Yeah. You know, all Aries are super smart. Sometimes a little bit fiery.
Yeah. You know, it's funny because I'm partly because of you and a few other, Deborah Silverman, I think her name is.
Sure.
I've gotten this, just like this intuitive, like I have this calling to learn all about astrology right now.
Yeah.
And yeah, it's just like, all right, but you know, it's like what I do with everything. Do I have the time? I have 8 grandkids. I have a busy life. So it's like
Your life, how old are you?
I'm 63. I'll be 64 next year.
Okay. So this is your Aries year. This is your year where you're getting stuff done, where you're becoming and integrating all that new stuff you've been learning. Next year is the year you're manifesting your new life. So that's why you're getting called to do that right now. And you're also a master level Aries, probably a 25 degree. And so you're being called, it's like a calling for you to help people in a new way.
Yeah, you know, Gary, it's funny because I think what you're doing is great, and I had the good fortune. I was very sick in 1990, and after a couple of years of working with Western medicine, I found these great healers, and everybody. I just fell into great hands. You know, a couple of odd hands as well, but then you just didn't go back. And I always say that was before Dr. Oz and Google, so I was very fortunate. But fear always kept me back of doing it 100% of what I always felt like. I love, you know, health coaching, and I love instructing yoga classes, reflexology. I love it all, but I always like held back and kept the safe job as well.
Are 1993, 1994, is that when you started teaching and coaching and stuff like that, started learning?
No. I was very sick in those days. I was like had a PICC line in for a couple of years. I was on medication for many years. I didn't start until it was mid 2000.
Okay.
I think I went back to school. I was really learning. I mean, I started all of this. I didn't really. The reason why I even went back to school was I felt I needed credentials because so many people were asking me what I did to get well because I had CNS Lyme, and it was like I was probably one of the sickest people I ever knew from it. And I felt like, oh, I can't do this. I don't have the credentials. So I really kind of knew everything from everything I learned from these amazing, amazing mentors of mine and gurus. And then what happened was I just to bring it out into the world is really why I went back to school for credentials. So I went to various places. We had local community colleges that had, believe it or not, classes in 2000 for like herbology, reflexology, essential oil therapy. They don't have it now, but they had it then.
Yeah, I mean, there was if you want to get educated, it was easier to get educated about that stuff 30 years ago than it is today.
Yeah, I think that's so funny though, but it seems like so many more people are aware. But what happened was I was doing great. I still had the fear within, and I knew exactly what happened. There was a trauma 2 years before I got sick. You know, there's definitely a lot of emotional trauma between my husband and I. But so the last couple of years, probably I think since I went full time here, I just have like you can even hear my voice. This happened 2 days ago. Well, like you're telling everybody, everything is coming up. I even share that with clients. You know, I'm like, it's all coming up, and that's what's happening with me. Everything I've dealt with has been coming up. Yeah, and it's just I don't know.
Today's a day you're gonna have some old patterns come up, like an old emotion, an old feeling, an old way of looking at something. You've changed a lot in the last, and for you, you've changed a lot since your birthday, and you're coming up to the biggest change in your life.
I can feel
And
it.
And you're probably letting people go, drawing boundaries, saying no
Yeah,
more. Yeah. So, so you're just preparing to be who you're going to be. You haven't started your life yet. That's
I
what I
know.
want to say.
I can tell. I know exactly. It's exactly how I feel. So even with all this, I was always petrified when I'd get sick. I was always fearful, very fearful of health. And like even with all this, with my voice going out again, yeah, I know it's the throat chakra that I'm working on. I was even doing the moves with you before. Luckily, I'm in my office by myself today because 2 people called in, and it just I'm just going with it. The fear is actually dissipating, dissolving, leaving. So it feels really good.
Yeah,
Although it doesn't.
you've been carrying the fear for other people,
Oh, I
like a good
know.
soldier. Um, and so that's it's not your fear; it's fear leaving your body. But when the emotions are big, then the brain has to explain them. It can't not explain them because that's the way that the brain gets an emotion out. It has to have the emotion. It goes, okay, I recognize the emotion. Now, what's the narrative or the story? And if it's a story that I've told before, it just keeps ping ponging. But if I stand outside of it and observe it, then it triangulates out of my system. So what you're doing is you're getting rid of a lot of fear that you accumulated. And most likely what you did, it was 33 years ago that you were sick.
Yeah.
So during that time, that's a karmic cycle, 30 years, because you
Yeah.
got sick when you were in your 30s.
Yes.
And then so now you're in your 63, 30 years later, it's a complete karmic cycle. So basically, your
Right.
karma is coming back around the same kind of feelings, but this time you're not sick, you're not down in your bed, but you're getting the same kind of feelings as you had 30 years ago.
All right. Right. Not as fearful, I guess, because the fear has finally leaving. It's finally like I know. I've always known. I've always, I've learned so much from these just amazing people over the last 20 years. But my head and my heart are finally merging. Like really fun. It's like exactly what I teach other people. I'm finally starting to actually do myself. It's like just actually, I'm actually loving myself more, even though I don't feel great. I'm loving myself more, and even those parts of myself that seem unlovable, I'm finally like, no, I'm good. I'm good.
But just like a good Aries, you teach everybody else, and then one day you become it.
I know. But it took a hell of a long time. But I keep telling myself this is divine timing. This is when it's supposed to happen. I'll tell you. So when I got sick, I was early 30s, as I said, and I was a young mom of 3 kids. And I remember going to church one day, and I was just so sick, and I was like, I couldn't take it anymore. And I made this agreement with God, and I was like, just make me well, and at least till I'm 30. And then at least till I'm 60, and then my youngest child would be 30, and then they're all on their own, and then I'm good from there. So I think I swear since my 60th birthday, when I was 60, people thought I was 40. Now I'm 63. In the last 3 years, I've aged, more than it's unbelievable to me how much I've aged in 3 years. So I'm like, all right, God, I have to rip up. I had to redo the contract. I was like, when I was 30, 60 sounded old. 60 is not old. So I feel like I have another 30 to go, but I just need to be healthy and doing really authentically 100% being me.
So it's to it's to speak your truth is what you've been dealing with, and it's about resentment and angers that you've kept in your bodies and being fearful of not speaking them because if you speak them, then you're not accepted.
Right, right.
So that's what it is.
Yeah, yeah,
And you're getting a second shot at this now at 30 years later.
right.
Yeah, but that's why you were sick in the first place.
It's funny because, yeah, and that's what I've been doing lately. I'm like, wait, hold on, I got to say this. Like even to my husband, I'm like, you got to hear this.
Okay, so
Yeah,
let's do something right now.
go ahead.
Yeah, can you put your phone down?
I can. Hold on one sec. This is hysterical. So many times I'm like, oh, I know he's picking me today. And today I didn't even think about you choosing me. Okay.
Okay, right hand on your heart.
Should I stand? I'm sitting
No, you can sit. You can sit.
like that.
And left hand on your throat. Okay, breathe in through your heart. 2, 3. Thank you, body, for holding all of the emotions
Thank you, body, for holding all of the emotions
until I was ready to process them.
until I was ready to process them.
I'm ready to process them now.
I'm ready to process them now.
Breathe in through your nose to your neck. 2, 3. I'm ending my old narratives today on how I speak my truth.
I'm ending my old narratives today on how I speak my truth.
I'm releasing anything that blocks me from speaking what my heart wants.
I'm releasing anything that blocks me from speaking what my heart wants.
I love speaking what my heart wants.
I love speaking what my heart wants.
Breathe in through your mouth again. 2, 3. I'm letting go of resentment and anger that I've held.
I'm letting go of all resentment and anger that I have held.
Breathe in through your nose. 2, 3. I'm letting go of the judgment I've held towards myself and others.
I'm letting go of all judgment I've held of myself and others.
Okay.
Yeah, feels good. It just was very easy to articulate that. And I don't always articulate so clearly, but
Did you notice your voice just changed?
I had been, yeah, it's gotten a little stronger. This only happened Saturday. I had a glass.
Not as raspy.
No. So what happened was I was fine last week, and I had a glass of wine. I was out and I after the second sip of wine, I finished it. It's not that I didn't finish it. I felt this immediately.
Yeah. Don't whine about it.
Well, I only drink dry wines, the dry farm wines. But I was out.
Oh, good. I wasn't even gonna ask, but thank goodness you said that. Dry farm wines. I love dry farm wines.
Yeah, that's the only ones I have at home. But this was out at a function. I was being social. I'm telling you, the second sip, and I even got one from Argentina. I think I didn't want anything from in the U.S. It's the second sip. I'm telling you, Mike, this happened. So I was like, I was not meant to have that wine.
Yeah, well, I don't think it's the wine so much. Argentina's got a lot of Aries energy, by the way.
Oh.
And I think it was just consequence and space and time. It was, 33 years ago, 30 years ago, you weren't speaking your truth. This time you are speaking your truth. So it's releasing the trauma that was held in your throat.
Wow.
Also, that's why the aging happened. But my gift to you is that doing the maneuvers and hydrating your body and getting rid of the emotions, you'll get younger. I mean, you look at everybody on our team.
I see you. I've seen your transformation. I'm like, wow, that's how I was. I was like, wow.
You're just going through a gateway.
Yeah.
And this transition is.
Go ahead. What?
I said this transition is like jamming a marshmallow through a keyhole, though. People are going to feel it. Yeah.
So I've been doing the 28-day reset for a while now. So I did, what is it, the 1 day, a 3 day, a 7, I think, and then 28. So I ordered the supplements, but I just don't feel comfortable taking that many supplements. So I know I take, I have Power Kirk here.
My intuition is you don't need it anyways. So use the Power Kirk and the minerals and the Power Kirk. Take that a higher dose, but the P3OM and the Masszymes, take those on normal doses, the way that they recommend it, because I can tell that you've been taking care of your health. It's meant for complete resets.
Okay.
But the transitions you're going through, the tissue's trying to open. Right. And the Power Kirk helps it open. The minerals are what's getting the water in to process, and it's also rebalancing the hormones.
So I was told, so I go, for some energy healing every now and then. And I had one person tell me years ago to take diatomaceous earth. What was his name? Victoris. He was one of the people that was instrumental with starting Hippocrates years and years ago. And I just couldn't drink a powder like that. I was like, I just can't do this, But
That's
he
why we have it
recommended.
in capsules.
Well, I know. And then I started taking it. And then I've been in a chiropractor and he told me not to take diatomaceous earth.
If you want, we'll send you a DM us, send you 31 evidence-based facts for taking diatomaceous earth. I don't
I
know.
trust it.
Yeah, listen, like there's a lot of, I feel sorry for the practitioners out there right now because, like, first of all, the science and the evidence has been so manipulated.
Right.
I have the benefit of seeing hundreds of thousands of people under a certain discipline, and they report back to me. So even when when I was a clinical practitioner, I'd see them in the clinic for a couple of weeks, and then you wouldn't see them again for a couple of years.
Right.
So you don't really know if it's working or not.
Right.
And we have that feedback mechanism, so we know what works and what doesn't.
Right. And then you've mentioned so off. I guess that's for me. I don't know what it is. I'm always, even though I don't want to say I'm not, I know a decent amount about herbology, but I'm always like questioning myself with it. So I always tend to take less than more. And boron, I did get in a liquid form. Mm-hmm. And I'm like, because I hear you talk about it, I have oral, I had implants put in, the zirconium ones. And I've had oral issues, which they only started probably, I don't know, maybe 7, 8, 9 years ago. Never had issues with it before. Well, I had braces as a kid and stuff, but you know what I mean. And then I heard you say one day that there's so much going on with people with their oral cavity.
Is it your upper right molars?
This was my left. This is on my left. The left.
Or sorry, upper left molars. Though?
Yeah.
So here, it's feeling
there and below. And
okay, the upper left one's about feeling outcast from the world that you live in, like different.
Yeah.
Okay. Go look at the metaphysical reason for each tooth.
Yeah.
Okay, yeah. And so you're going on a journey and the teeth are just showing you. I mean, it was funny because until my sister who's a master level Aries, she's a grandmaster in intuition. So she raised me, and I'm an Aries rising too, so I really get Aries. So she was having some problems with her teeth, and one of them stopped her from going on a trip. So she pulled out this old metaphysical book, like probably like 60 years old, right? And I was looking because I've been waiting to understand what's going on with mine. Like I know they regrow. There's a device out of University of Alberta that's meant for hockey players originally. It regrows teeth. There's a drug that regrows it, but I don't want to do that. I want them to do it by themselves. And so I needed to connect with it. And then when I looked at the actual metaphysical reason for those particular teeth I was having was 5 and 6, 11 and 12. It's sexual abuse from a parent. It's lack of sexual expression or lack of ability to express properly. And these are the components of who I am. But that also is what made me so expressive.
Right.
And I didn't hear that till the other day. And so because I've been waiting I have a friend named her name's Dr. Ala. She's the best Sujok therapist in the world, like not even hands down. And she's been wanting to do this teeth treatment on me to stimulate these. And I'm like, no, not until I figure this out. Right. And then it was just served up to me on a plate. So go back and look at why those teeth are, and then connect with that.
So I always look at the metaphysical reason for things, but I always look up Louise Hay, who I actually had the pleasure of spending a weekend with once in 2011. And I thanked her for saving my life, because she did. And years before that. And she's like, no, Nancy, you saved your own life, So she was just amazing. So I always look up her work and her
She's awesome. Yeah.
She was amazing. She was just amazing.
That's where I reference to a lot of it.
Because I can't find the teeth with hers. I can't find them
I couldn't either. That was the funny part. So metaphysical anatomy is one, but the one that my sister brought out, I don't even know the name of the book. I'll figure it out and I'll post it
Okay. All right. Good.
because it was an older one. Metaphysical anatomy is actually a pretty good one. I mean, it's pretty
Uh-huh.
thick. It's like a Bible.
I love that stuff. I always go to that. I always go to the emotional component to everything and anything because I know me. I know there's always an emotional component. You know, I know when I got sick, like I said, 2 years prior to getting really sick, it was like I had a first chakra illness, and I wasn't feeling safe and secure in the world. You know, so
So you're on the East Coast, right?
I am. I'm in New York. Yeah,
Okay.
yeah, yeah. I wish you would come here. I tell you, I would love to go work with you guys.
New York's a spot. I mean, Denise out there, who's out there. Denise, New York is definitely a spot that we're planning on going to. We've been doing these little events. Like Vancouver is our hometown, but it's a little
I
place.
know.
Because we're working on how to do it.
Mhm.
Like when we went to LA, we went to Joshua Tree because if we did in LA,
I
there would have been
know.
5,000 to 6,000 people, and we weren't ready for that. I mean, I think we're ready now, just
Right,
because moving that many people and knowing what to do, it takes
right.
some
I'm.
practice. So we've been practicing, getting
Yeah.
ready for New York. New
I
York,
loved her.
New
I
York
love.
will be like 15,000 people.
Well, I'm in Rockland County. I'm about 40 minutes north of the city. And then my husband and I just bought a place, a small condo in Florida. So he's there now. So we'll be like going back and forth. So that's always a possibility too. But I just think what you do, how you're helping everybody is absolutely amazing. And again, I have fallen into great hands over the years. So I've been very fortunate too. But what you give back, it could make me cry. I just think it's beautiful.
Well, I think maybe you're joining the tribe here sometime soon.
Yeah. Oh, I hope so. I
So
hope.
go get in you've done the 28-day reset. By the way, there's a new one on our new
I know. I
platform.
got all confused. You know, it's like
Yeah.
technology and me. I'm like, oh, why are they changing this on me?
Yeah, because the new one and you can do everything within it. It's super. It's so much easier than because right now we have Zooms over here, we have meetings over here. We've had to cobble it together. So the new one is with everything,
All
so
right.
that we can grow. And the lifestyle artist program, though, get into that.
I would love to, but do I have to finish first or I can pop right through it?
No, go to day 28 because you've already been in the old app, and then you can sign up for the next interview. And there's one starting up here January 1st.
Oh, perfect. Now I do have one question before we part because I could talk to you. If you called me, I always hear you say to people that you were meant to talk on that day. Had you
Yeah.
called me any other day, I would have given you a list of all my ailments. Where today I'm like, I'm not going to give you a list of my ailments, but
Oh, I think this is like I said, the old karmic pattern coming up. Which so do you know your chart? You have a lot of Capricorn in you.
I don't know. I have had it done before, but I don't really know. I know my rising sign is Sagittarius.
Okay, there you go. I'm a Sag. I'm a Sag Aries.
So I'm an Aries Sag.
Yeah,
Yeah.
there you go. Yeah.
Yeah.
So today's an important day. Today's a getting it done day. Today's a day where we get the inspiration to do something new.
Yeah. Okay. So the question before we part is I started telling you before I bought a boron. I got liquid boron.
Mhm.
How do you take that? It's
I don't know. I
1.25.
don't know. Is there a measurement?
Yeah, and it says
Good.
1.25
Put it in
milliliters.
water. Yeah, put it in water. Put it in juice.
How much do you take? It's like it says
100 milligrams.
100, so a little less than all right.
Yeah.
Yeah. Okay.
Yeah. And it'll start making a change. Like it's funny how fast it works. Like boron and silica both are like these amazing, absolute amazing minerals and elements that are literally extracted out of the education system for healthcare.
I know. Well, I probably have a gazillion things I'd like to say, but just thank you very much. I really appreciate you taking your time and choosing me today, which I was still shocked, and the fact that I'm here alone and can speak to you like this.
There you go.
Yeah,
That's
I
why it
know.
happened.
I know. So I hope I speak to you again, and I hope I get to work with you guys in the near future.
Get into the Lifestyle Artist program, and that's where we spend all of our time.
Yeah, I'm going to. Thank you so much, Gary. Happy
Bye,
holidays to
Nancy.
you. Take care.
Take care. Yeah, 20 team, 20 meal team. Yeah, I use that one. Had some this morning. What does boron do? If you want, you can DM us and we can send you an NIH report on boron. Yeah, it's super powerful. Super powerful. Whoa, everybody wants to talk today. Teresa. When you're born, okay, what, if you don't believe in astrology, well, Teresa? Is that Teresa? Hello, hello. It's TGVS, TGV Spaces. Hello.
Yes.
Is
Hi.
it Teresa? Is it?
Yes, it's me.
Hi, Teresa.
Hi. Do you hear me clearly?
I do. Where are you located?
I don't see you, but I see me, so I hope the
Yes.
communication is flowing.
Yes.
Okay, great. Wow. I feel so grateful. I have just passed a profound organ reset the last 2 months.
Mm-hmm.
And I will share with people that has, well, maybe they are passing with bad feelings and physiological heart moments. And the thing is that I have been working with the bad feelings and the breathing problems, and also with the I don't know. I'm a little bit nervous and my English is not flowing.
Where are you? Where are you from?
I'm from Canet de Mar, is a little town in Barcelona, Spain.
Okay, cool. And when's your birthday?
The 5th of December. I talked to you in a Zoom in Life Artist program.
Oh,
I
okay.
thought it was in June.
Okay.
Yeah.
I got it now. Yeah. So,
Yes.
yeah, so you're a Sagittarius coming to the new
Yes.
belief in who you are.
Yes. And I think that fascial maneuvers I have been practicing with delight and sometimes with some kind of exigence sometimes. 1 year really deep. And now I have been with the organ reset really deep. And also with the liver, yes, with the liver, a lot. And the thing is, when I was in fever and without sleeping and all that stuff, I just take care of me with the fascial maneuvers on bed or before dancing, because I was dancing ill performance. And before dancing, making the maneuvers, and I was able to feel strong, really strange, with vomits and everything, but with the fascial maneuvers before the performance, I was feeling some kind of energy that arose from another place, not the common place. And I feel grateful. It's all I can say to you. And also, I have the dilemma of not doing them, because I have been doing them so much, and sometimes I think maybe it's too much. I have this dilemma. Sometimes in the morning I get up.
You know what? It's
and
fascial maneuvers is replacing movement that we used to do when we used to climb and play and work. So it's hard to do too much. But sometimes if I feel too emotional or I've got too much going on, like when I come back up to Canada and it's cold, I do less of them. And it's good contrast, like, because I get to see what does my body do when I don't do them. As a matter of fact, I've been getting better this last couple of weeks because I do a whole bunch of work, especially when I'm in warm climates, and I come back to cold climates, and I tend to be inside a bit more. So it's good. It's good to like have contrast.
Hmm. I'm getting that. I have listened to Jason also. I love the way Jason says I'm not doing them for sometimes just for getting the contrast, and also with food and stuff like that. Because if not, I feel myself falling into some kind of rigidity,
Yeah.
or like what's the good thing and the bad thing, and I don't really want to go there.
Yeah,
And
you need the contrast, especially as a
Mm.
Sagittarius.
and also at classes, because I teach classes, I have a group. With them, I really do the fascial maneuvers with the intention and all of that, because I have 3 hours with them. It's for movement theater and all that. And we have started in September, and that group has changed so much in communication process, in collaborating. It's like, wow, the fascia teaches all of us all that stuff, and the hierarchy is not so clear like in all the other groups. And I love that because it's like my group control. And I have another groups.
That's really good because you've got a way to see how much it impacts people over a period of time. So, and
Yeah.
that's really where the real healing for me didn't come. Well, it came partially through me doing maneuvers, but the real healing for me came in helping people go through their own journey.
Hmm. And the communication process, I think it's incredible. It's the same ability of communicate one feet with your hand or with your heart, and you with another being.
Yeah, yeah, yeah.
And we have found it like something natural at the class with some groups, and in other groups there's still the idea of ability that doesn't leave the feeling, the sense of communication.
Mm-hmm.
In arts, it's really a problem, that for me. The
Mm-hmm.
skill or the presence.
You're just going through a journey. You're
Yeah.
learning. It's because it's teaching you about yourself again.
Mm. And I feel a tribe because I have been feeling so lonely and so freaky and autistic a little bit because my need of movement. And now I found a tribe with you and with some other people, and a lot of students are asking me how I do, and I'm sharing fascial maneuvers, and a group of them are doing it, and with resets and with bad feelings and going through it because I'm going through it, and it's really inspiring. You have really inspiring me to share some things that I will keep in my intimacy, you know,
Yes.
like it's my process,
Yeah.
and I'm sharing that.
I'm really glad that you're doing this. And there's a massive community in Spain starting up. So we need more.
Mhm. Yeah, thanks a lot. I appreciate. I have had some dreams. I had a dream last night that I had a metastasis and a cancer from here
Mm-hmm.
inside. I was feeling everything inside until in the left side of my abdomen, it was a wall of iron. And I was feeling all that absolutely inside me, and it start to dissolve. And it was
Yeah,
empty space, and it was
you're
like, wow.
you're processing traumas from other states of awareness or other lives.
Hmm.
Yeah.
And
You're
I'm
putting
not
it all together.
scared.
You're putting it all together here.
And all the organs, now the organs are are me. It's really strange.
Well, technically, we don't really think. What we do is interpret the signals from the body. And so that means our organs are our emotions, and each one of them is different. So technically, we're just a big carrying case, suitcase for the organs.
And the density of the body has changed so much with the organ reset. I'm really like, how it's possible? It's the same body because the density inside, because I work somatics for 20 years.
Yeah,
And
density's gonna change. I can't believe that I'm 100 and like, I'm probably be 170 pounds right now. 106 pounds, 170 pounds. The last time I was this body weight, I was 14 years old. I had too much density to get below 200 pounds for 40 years. And here I am. And there's no explanation for it. So yeah, things are changing. I believe we're changing I believe human beings are evolving. And, one fish has to crawl out of the water first. And I just think I'm the fish crawling out of the water.
Yes, and the lightness and the sense of humor that arise from that new quality inside. Wow, it's a big present.
Yeah.
So thank you.
Well, I'm glad you came on to say it. And are you going into the level 2, lifestyle artist level 2?
I leave the life artist one. When you change it, there was not the Zoom calls on Saturday, and for
right.
me it's like, wow. I was like, oh.
You can still do it,
But
but
I'm
we're changing it.
practicing.
Yeah, we're changing now. The calls are during, but we're you can still do it. There's more opportunities and there's more groups starting within. So go to the level 2.
Yes, and also I have this opportunity now that I didn't expect this. So also life brings me the opportunity to contact with you again, and appreciate everything. And I appreciate what I'm doing for another people, really, because I have seen them changing, and it's so beautiful. People that you know from a long time, or maybe students that are really changing and walking their path is so beautiful, and with no guru around.
Yeah, they're doing it by themselves. That's the best part.
Yes.
Well, I look forward to
So,
seeing you in level 2.
yeah, see you.
Okay.
Thanks.
Thank you for coming on, Teresa. Barcelona, Spain. One of the years I almost went there before I came back to Canada. Chris Alba. 17 degrees. Paige Carly Howard. You're 17 degrees what? Sagittarius? 17 degrees. Barcelona. Yes, there's more Barcelona. I tell you, you guys should contact each other. What does a degree mean in astrology? Basically, it's like a month. It's like a birthday. There's 30 of them in each sign, and each degree has a slightly different aspect. It's like saying that you're American, but you could be African American, Asian American. You could be from the north, the south. But there's different versions, or you're European, but you could be French, you could be Spanish, you could be Italian, and each degree is like the sign, like Sagittarius is like the continent, and then or the country, and then each degree can be an area of that country which is different. So it's a different way of expressing itself, if that makes sense. Dental reabsorption, 3 teeth already lost, 2 orthodontics pulled roots.
Hi,
Hello,
Gary.
hello.
What's
Oh,
up?
what's
You're
up? Yeah, I talked to you, right?
Yes. So
That
two
was
things.
a, that was not too long ago, right?
Yeah, it was probably like a week and change. I was talking
Okay.
to severely dehydrated. I did blood work. They talked about the vitamin D and dehydration. I started the diatomaceous earth 2 days before we were speaking, while I was also like doing minerals, all that stuff. So I want to update on that. The diatomaceous earth is helping lots. Yes.
You know what? I have people that negotiate and try to, you know, they're doing everything right, but if we're not taking diatomaceous earth or silica from some source,
Uh-huh.
everything else we're doing isn't working right now. Is people are like, I can't get my iron up. I have iron deficiency. It's silica. I
And
have
everything.
digestion problems, silica. Yeah.
I was doing everything. I did the IV drip. I did magnesium, potassium, um, everything. So,
That's
what I
awesome.
yes, I'm getting there. The balance is slowly, you know. So I need your help with something. I am having a really bad allergic now.
To which?
Um, um, well, first I thought I accidentally ate gluten because I have a gluten sensitivity, but I'm starting to think that I'm allergic to goji berries. Just started eating goji berries like a
It
few
feels
days.
like your body can't take goji berries right now. And I don't think it's not an allergy. Think of it as a sensitivity because each food fires a set of hormones, works on a separate organ pathway, detox mechanism. So it feels like as soon as you said it to me, it feels like goji berries, maybe hold off for a bit. It's probably doing something your body's not ready for yet.
Yeah, I did a lot at one time. Like I soaked a bunch and my whole, you probably can't see, but all of this is in hives right now. And
Yeah.
it's extremely itchy, like type
So
of itch.
that's so what that's doing is it's a detox. It's actually good, but it just doesn't it feels bad.
It feels,
So do the upper reset.
yeah, I did the belly button release last night and that helped a lot.
But the
Um,
upper reset will get the tissue up here moving.
okay,
Yeah.
I will.
Yeah.
I
And
also,
then the other thing, yeah, the other so as you start going through and detoxing and getting hydrated again, all the stuff that was sticking in there comes out. And so it's like don't put too much into what is happening. The goji berries could be like taking a medication. Food's a medication. So it's
yeah,
taking a medication that you don't need right now. That's all.
yeah, okay, so don't put a label on allergy.
Yeah, because you know, like for the most part, our bodies are meant to adapt to everything.
Hmm.
Um, you know, I have even people with like serious nut allergies or shellfish allergies that when their nervous system's completely clear, they can go back and take it, eat it. It's that there's some sort of intolerance or it's activating something, but the body's meant to adapt. And if it's not adapting, it's because it's under stress somehow.
Do you have any suggestions to soothe the itching? Because it's like,
Yeah,
I,
you can put take some chia seeds, grind it up
mm-hmm,
in a coffee grinder, put some diatomaceous earth.
uh-huh,
If you want to put like lavender, if you have lavender oil or something like that in there, it will work.
mm-hmm.
And you can actually take and put a few oats, like grind them up in a coffee grinder too, and make a paste out of it and just put it on like a mask. The and then bath in that diatomaceous earth and borax. What'll happen is the chia seeds are an emulsifant, so it takes the oil and water and blends it, so it'll bring moisture into your body really quickly. So I do it in a bath. I put it all in a bath, that same concoction in a bath. Then I get underneath the bath, and then I keep some of it out so I can put it on like a paste and sit there with it and let it sit for like 30 minutes, and then go under and wash it off again.
I don't have a bath. Do you
You
think
do a
I should
shower.
pay it?
Yeah, you do it in a shower. Do the upper reset. Do
Mm-hmm.
it. Get yourself wet. Put it on. Let it sit for like 30 minutes, and then go back and shower it off.
Do you think Shivambu is too um
No, that'll work.
okay?
Yeah, yeah. I mean, topically for sure.
Mm-hmm.
I mean, basically, the hives are just something detoxing. It was something that let out, and you're doing things to clear up your body now. So it could be literally your body's ready to let it go, and then that goji berry just pushed it over the edge because they're very healing.
Yeah, yeah, yeah. I did a little bit of the diatomaceous earth with water today,
Yeah.
and it did it. I'm gonna go to the beach now and go into the ocean and
Yeah,
get
that'll help too. Yeah, but do the upper reset maneuvers. It opens up the tissue. That's a really good way to do it because it's what that was is think of it as layers of fascia, and then those layers are some toxins, and it was squished. Well, now you're starting to open it up. Well, now it's trying to express itself, so it just wants an easier way out.
Okay. Thank you so much.
Hey, well, let me know how it goes, okay?
I will. Peace.
Okay, thank you. Okay. It's 9:50. I think let's cut it off there for today. We have Astro Monday. If you have something that you want to review on your chart or your astrology, we're going to be pulling up some guests today. So just let us know. Put what it is that you're wanting. Put your sun, moon, and your rising on Astro Monday if you're going to come and join us. And put I'm looking for answers about this, and then put it down in the message thing, which is right about there. So create a new message. Or no, sorry, right there, the second one over. And let's have a good time with this. This is going to be fun today because we're coming to the transaction day. So it's Monday. So as Chris said, Saturday was a big one. I mean, it was a big one. Things happened for me. I can't even begin. I'm just processing it now. But we're coming up to the equinox on Thursday. My birthday's on technically my birthday's on Thursday. It says Wednesday because the 20th, but the 20th, the calendar lies. My birthday is actually on Thursday. It's the 29th degree. And for those of you who are 29 degrees in your sun sign, we have a meeting on the 29th degree of Sagittarius. How much more perfect could it be? Okay, everybody, we will see you a little bit later on.